Let's talk about something that almost nobody wants to talk about, but that affects a huge number of people watching this video right now. Constipation. I know, not the most glamorous topic, but if you're over 60 and you've noticed that things just don't move the way they used to, you are far from alone. Studies suggest that more than 40% of adults over the age of 60 deal with this on a regular basis. And for many of my patients, it quietly affects their energy, their mood, their sleep, and their quality of life in ways they don't always connect back to their digestion. And here's what frustrates me as a doctor. Most people either suffer in silence or they reach for harsh laxatives that their bodies weren't designed to rely on long term. So today, I want to offer you something different. No prescription pads, no expensive products. Just 5 foods, real everyday foods, that have genuine scientific support behind them for gently and naturally supporting healthy digestion. Some of these might surprise you. One of them actually outperformed a common over-the-counter laxative in a clinical trial. And the 5th one? It's something you can do before you even eat breakfast. Stay with me, because by the end of this video, I'm also going to share a simple morning protocol, a gentle daily routine that combines all 5 of these foods in a way that's easy, affordable, and sustainable. Let's start with the why. Before we get to the foods, I want to take just a couple of minutes to explain why constipation tends to become more of an issue as we get older. Because when you understand what's happening in your body, the food choices I'm about to share will make a lot more sense. First, the muscles in your digestive tract, including the large intestine, naturally lose some of their tone and efficiency as we age. That means the rhythmic contractions that push things through simply slow down. What used to take 24 hours might now take 36 or 48. Second, many of the medications that are very common in this age group, including certain blood pressure medications, iron supplements, and pain medications, list constipation as a side effect. If you've started a new medication and noticed a change in your digestion, that connection is worth mentioning to your doctor. Third, and this one is often overlooked, as we age, our sense of thirst becomes less reliable. Many of my patients over 60 are mildly dehydrated without realizing it, and dehydration is one of the most common and most underappreciated causes of constipation. Your stool needs water to stay soft and movable. And finally, reduced physical activity, even small reductions, can slow down the whole digestive process. Now, I want to be clear about one thing before we go further. There's a difference between occasional constipation and chronic constipation. If you're having fewer than 3 bowel movements per week for more than 3 weeks, or if you're experiencing pain, blood in the stool, or unexplained weight loss, please don't wait. That's a conversation for your doctor, not a YouTube video. But for the many of you who are dealing with sluggish digestion, harder stools, or just wanting to support a more consistent routine, the 5 foods I'm about to share are a wonderful, gentle place to start. Let's start with the one that probably doesn't surprise you, but that's far more powerful than most people realize. Prunes, or as they're now more elegantly marketed, dried plums. Now I know, some of you might be thinking, Dr. Kim, my grandmother used to tell me about prunes. And she was absolutely right. But I want to go beyond grandmother's wisdom and actually explain why prunes work, because the science is genuinely impressive. Prunes have 2 main mechanisms working in your favor. First, they contain a natural sugar alcohol called sorbitol. Sorbitol isn't well absorbed by your body, so it pulls water into the large intestine, softening stool and making it easier to pass. Second, prunes are rich in insoluble fiber, which adds bulk to stool and keeps things moving. But here's the part that often surprises people. Prunes also contain phenolic compounds, natural plant chemicals that appear to directly stimulate the muscle contractions in your gut. This is why prunes work differently and often better than simply eating any high-fiber food. A well-designed, randomized controlled trial published in Alimentary Pharmacology and Therapeutics compared prunes head-to-head with psyllium, a common fiber supplement, KID, in adults with constipation. The prunes won. Participants eating prunes had significantly better stool frequency and consistency. I had a patient, a 68-year-old woman I'll call Margaret, who had been on a calcium channel blocker for her blood pressure for about 2 years. One of the side effects was chronic constipation. She had tried fiber supplements with some success, but not complete relief. I suggested she try adding 3 to 5 prunes every morning with her breakfast. Within 10 days, she came back and said it was the most consistent relief she'd had in 2 years. So here's how to use them. 3 to 5 prunes per day is a good starting point. You can eat them whole, chop them into oatmeal, or blend them into a smoothie. If you prefer a liquid option, 4 ounces of pure prune juice in the morning works well. I'd recommend eating them with breakfast rather than on an empty stomach, especially if you have a sensitive gut. One caution: if you have irritable bowel syndrome or you're watching your blood sugar carefully, including if you have diabetes, prunes are relatively high in natural sugars. Start with just 2 or 3 and monitor how you feel. And if you have any concerns, check with your doctor. Food number 2, kiwi. This is the one that surprises most of my patients. If I told you that a small green fruit could improve your bowel movements more reliably than many supplements and with no known dependency risk, you might raise an eyebrow. But that's exactly what the research on kiwi suggests. Kiwi contains an enzyme called actinidin, and this enzyme is genuinely special. It helps break down proteins in your digestive tract and accelerates the rate at which your stomach empties. This keeps things moving through the pipeline more efficiently. On top of that, kiwi is rich in pectin, a type of soluble fiber that forms a gentle gel in your intestines, softening stool without causing cramping or urgency. The clinical evidence here is compelling. A large study known as the ActiForce trial looked specifically at adults with functional constipation. Participants who ate 2 green kiwis per day saw a significant improvement in stool frequency, consistency, and comfort. And importantly, these were older adults, not just young, healthy volunteers. Let me tell you about a patient of mine, I'll call him Robert, 72 years old, who came to see me several months after a hip replacement surgery. The pain medications he'd been on post-surgery had left him severely constipated, and he was nervous about taking strong laxatives because of concerns about dependency. I suggested he start adding 2 kiwis a day to his diet, alongside his recovery meals. He told me it was the simplest, most pleasant solution he'd tried, and it worked consistently without any side effects. Here's how to use kiwi. Aim for 2 green kiwis per day. You can eat them as a snack, slice them into yogurt, or blend them into a morning smoothie. Now here's an interesting tip. The skin of a kiwi is actually edible and contains additional fiber. If you wash it thoroughly and don't mind the slight fuzzy texture, eating the whole kiwi skin and all can give you an extra fiber boost. A couple of cautions. Kiwi allergy, while not extremely common, does exist, especially in people who have latex sensitivity. And if you're taking warfarin or any blood-thinning medication, kiwi does contain vitamin K, so mention it to your doctor and keep your intake consistent. Food number 3, oatmeal. If kiwi was the surprise, oatmeal is the steady, dependable partner you might have underestimated. Most people know oatmeal is good for you, but I want to explain specifically why oatmeal is so effective for digestion in older adults, because the mechanism is different from what most people assume. The key ingredient in oatmeal is a specific type of soluble fiber called beta-glucan. When beta-glucan meets water in your digestive tract, it forms a thick, viscous gel. That gel does several things simultaneously. It slows digestion in a way that prevents blood sugar spikes. It softens stool by retaining moisture, and importantly, it acts as a prebiotic, meaning it feeds the beneficial bacteria in your gut. This last point matters more than it might seem. Research has shown that a healthy gut microbiome is directly linked to regular, comfortable bowel movements. When you eat oatmeal, you're not just adding fiber, you're cultivating the environment inside your gut that makes everything work better. Research published in the Journal of Nutrition confirmed that regular consumption of beta-glucan from oats improved bowel frequency and stool consistency in older adults, with the benefit increasing over several weeks of consistent use. I had a lovely couple, both in their early 70s, who came to me a few years ago. Their breakfast for decades had been white toast with butter and jam. Not terrible, but very low in fiber. I suggested they swap just that one meal, replace the toast with a bowl of plain rolled oats. 3 months later, they both reported significant improvement in their digestion, and as a side benefit, they noticed their energy levels were more stable through the morning. Here's how to use oatmeal. Half a cup of rolled oats per day, cooked with water rather than milk if your digestion is sensitive. Cook them on the stovetop for a slightly different texture than the microwave version. And here's a tip that I'll return to in a moment. Adding a tablespoon of ground flaxseed, our next food, to your oatmeal is one of the most powerful combinations you can make for digestive health. One caution: choose plain oats, not the individually packaged instant varieties with added sugar and flavoring. Those added sugars can actually feed the wrong kind of gut bacteria. And if you have celiac disease or serious gluten sensitivity, look for oats that are certified gluten-free, as cross-contamination in processing facilities is common. Food number 4, ground flaxseed. Ground flaxseed is one of the most underused foods in the American diet, and in my opinion, one of the most valuable for adults over 60 who want to support their digestion naturally. Here's what makes flaxseed unique. It contains both soluble and insoluble fiber in a single food. The soluble fiber absorbs water and softens stool. The insoluble fiber adds bulk and speeds transit time through the intestine. Very few single foods offer both in meaningful amounts. But there's a third benefit that's less commonly discussed. Flaxseed is one of the richest plant sources of omega-3 fatty acids. And research suggests that omega-3s have a mild anti-inflammatory effect on the lining of the digestive tract, which can help reduce the discomfort that sometimes accompanies constipation, particularly chronic constipation. The clinical evidence is quite strong here. A randomized controlled trial compared ground flaxseed, just 10 grams per day, against lactulose, a common prescription laxative, in patients with chronic constipation. The flaxseed group performed comparably or better on measures of stool frequency and consistency, with no dependency risk. I want to share the story of a patient I'll call Carol, 65 years old, on a statin medication, and dealing with what she described as stubborn constipation that had resisted several interventions. She was resistant to adding another supplement to her routine. I suggested she simply add ground flaxseed to the foods she already ate, stir it into her morning yogurt, sprinkle it on her oatmeal, 2 tablespoons a day. She was pleasantly surprised by how little she noticed it taste-wise and how much she noticed it in terms of results within 2 weeks. Here's the critical how-to for flaxseed. You must use ground flaxseed, not whole flaxseed. Whole flax seeds pass through your digestive system largely intact. Your body can't break through the hard outer shell to access the fiber and nutrients inside. Ground flaxseed, sometimes labeled milled flaxseed, is what you want. Start with 1 tablespoon per day and work up to 2. You can stir it into oatmeal, blend it into smoothies, mix it into yogurt, or even stir it into soup after cooking. It has a mild, slightly nutty flavor that most people don't find intrusive. 2 important cautions. First, you must drink adequate water when using flaxseed. Without sufficient fluid, the fiber can actually worsen constipation rather than help it. Aim for at least 6 to 8 glasses of water per day. Second, flaxseed can interact with blood-thinning medications. If you're on warfarin or similar drugs, please mention it to your doctor before adding flaxseed regularly. And as a general rule, if you're taking any oral medications, don't take them at the exact same time as flaxseed, as the fiber can temporarily affect absorption. Food number 5. Warm lemon water. The 5th item on our list is perhaps the simplest of all, and it's one that I recommend to almost every patient over 60 who comes to me with sluggish digestion. A glass of warm water with fresh lemon juice first thing in the morning, before coffee, before breakfast, before anything else. Now, let me explain why this works. Because each component plays a role. Warm water, not hot, not cold, but comfortably warm, has a well-documented ability to stimulate something called the gastrocolic reflex. This is the involuntary response in your gut that's triggered when something warm enters your stomach. It sends a signal through your digestive system to begin moving things along, essentially waking up your bowels for the day. This is actually the reason many people feel the urge to have a bowel movement after their morning coffee. It's partly the caffeine, but partly just the warm liquid. Lemon juice contributes citric acid, which gently stimulates the production of digestive juices and bile, the fluids your body uses to break down food and move waste along. There's also some evidence that the aroma and taste of lemon activates digestive readiness in a way that plain warm water doesn't quite match. And then there's the hydration itself. As I mentioned earlier, mild dehydration is one of the most common and most overlooked causes of constipation in people over 60. Starting your day with a full glass of water before any food or caffeine helps counter that overnight fluid deficit. I had a patient, I'll call him Walter, 77 years old, who was a lifelong coffee drinker. His first act every morning was reaching for the coffee pot. I didn't ask him to give up his coffee. I just asked him to do one thing first. Drink a large glass of warm water with half a lemon squeezed into it while the coffee was brewing. That small change, literally 3 minutes added to his morning, made a noticeable difference within a week. He told me it felt like his body was more awake by the time breakfast was over. Here's how to do it. 8 to 12 ounces of warm water. Think the temperature of a comfortable bath, not boiling, with the juice of half a fresh lemon. Drink it slowly over 5 to 10 minutes, ideally standing or sitting upright before eating anything. 2 small cautions. Lemon juice is acidic and can affect tooth enamel over time with daily use. A simple solution. Rinse your mouth with plain water after finishing your glass. And if you have gastroesophageal reflux disease, GERD, pay attention to how your body responds. Some people with GERD find citrus irritating first thing in the morning. If that's you, the warm water alone still offers real benefit. Now that we've gone through all 5 foods, I want to show you how they come together in what I call a gentle morning protocol, a simple sequence that takes less than an hour and combines the benefits of everything we've discussed. Here's what it looks like. Step 1. The moment you wake up. Before you reach for your phone, before you start the coffee, pour yourself a glass of warm water and squeeze in half a lemon. Drink it slowly over the next 5 to 10 minutes. This activates your gastrocolic reflex and starts rehydrating your body after a night of rest. Step 2. Breakfast. Make yourself a bowl of plain rolled oats. While it's still warm, stir in 1 tablespoon of ground flaxseed and add 3 to 5 prunes, either whole or chopped. You can add a small drizzle of honey if you like a touch of sweetness. This breakfast alone gives you 3 of our 5 foods in one bowl, with a combination of soluble fiber, insoluble fiber, sorbitol, and omega-3 fatty acids all working together. Step 3. Mid-morning or with lunch. Have 2 green kiwis. You can eat them whole as a snack, slice them over yogurt, or blend them into a small smoothie. This adds actinidin and pectin to your digestive system and extends the benefit of your morning routine into the afternoon. A few practical notes. If you're not currently eating much fiber, please don't start all of these at once. Increase gradually over 1 to 2 weeks, or you may experience bloating and gas as your gut microbiome adjusts. That discomfort is normal but preventable if you ease in slowly. And I want to say this one more time. Water is not optional. Every gram of fiber you add to your diet needs adequate fluid to work properly. Aim for 6 to 8 glasses of water throughout the day. Keep a glass on your nightstand, your desk, wherever you sit most often. Small changes, sustained consistently, can make a remarkable difference. Before I wrap up, I want to take a moment to talk about when food alone isn't enough, and when it's important to pick up the phone and call your doctor. Dietary changes can do a lot, but they're not a replacement for medical evaluation when something more serious might be going on. Please make an appointment with your doctor if you've made consistent dietary changes for 3 weeks or more and your constipation hasn't improved at all. You notice any blood in your stool, even a small amount. You're experiencing significant abdominal pain or cramping that doesn't resolve. You've had unexplained weight loss alongside your digestive symptoms. Or if your constipation came on suddenly and feels very different from what you normally experience. These can all be signs of conditions that need proper evaluation, and catching them early always leads to better outcomes. The foods in today's video are wonderful complements to a healthy lifestyle. They work best as part of an overall approach to wellness, one that includes regular checkups, staying active within your abilities, and open conversations with your healthcare provider about any symptoms that concern you. All right, let's bring it all together. If you're dealing with constipation and you want a gentle, natural way to support your digestion, here are your 5 foods. Prunes for their sorbitol, fiber, and gut-stimulating phenolic compounds. Kiwi for actinidin, pectin, and clinically proven bowel support. Oatmeal for beta-glucan, prebiotic fiber, and lasting gut health. Ground flaxseed for its dual fiber power and anti-inflammatory omega-3s. And warm lemon water for hydration, digestive activation, and the simplest morning ritual you'll ever adopt. None of these are magic, but all of them are real. They're backed by science, they're affordable, they're available in any grocery store, and when you combine them, especially in that morning protocol we talked about, they work together in a way that's more powerful than any one of them alone. Start small, be consistent, give it 2 to 3 weeks before you judge the results. And please, always keep your doctor in the loop, especially if you're managing other health conditions or taking medications. I'd love to hear from you in the comments. Which of these 5 foods are you going to try first? Let me know below. If you found this video helpful, a like and a subscribe go a long way toward helping us reach other seniors who are looking for practical, trustworthy health information. And if you have a friend or family member who's been quietly dealing with this, Share this video with them. Sometimes people just need to know they're not alone. Thank you so much for spending this time with me. I'm Dr. Leonid Kim, and I'll see you in the next video.